There are 4 programmes of work underway to deliver investing in Stockport. This series of short videos will help you understand more. This video talks you through Stockport Together, because this is how we're putting people across the borough at the centre of health and social care services by changing the way that social workers, mental health services, GPs, the hospital, community nurses and voluntary organisations work with our communities. The 5 organisations responsible for commissioning and delivering health and social care in Stockport are all working alongside voluntary services and communities to provide the best possible care for the people of Stockport.
The message in Stockport Together is we are going to work together from GPs, community nurses, the hospital and social care. Working together so that people feel they are talking to a connected system. They can tell their story once and they don't have to repeat it over and over. They feel people know about them and their problems, and that we can together proactively prevent problems for them, a problem or a crisis developing in an unexpected way. I can do my bit as a GP to help people, but we want people to help themselves more. We want people to use the Patient Access app, for example, to access GP services. It's free, it's safe, it works. We want people to do much more to look after themselves. Get outdoors, exercise, be positive, and make sure you don't smoke, make sure you don't drink too much, make sure you eat well, make sure you look after each other. Check on your neighbour next door if they're a bit older or a bit more frail. Eat a healthy diet. These things actually make a difference to how well you're going to live and how long you're going to live. So let's get going with these small changes that make a big difference. So the 5 organisations in Stockport are working together because we've got, over the next 5 years, some certainty about how much money we're going to have, and we've got some certainty about what the demand for healthcare is going to be in Stockport unless we do something different.
This new and different way of working can be seen in a small way in Cheadle and Bramall, where a new integrated neighbourhood team are helping patients to manage their conditions at home or in the community so they don't get worse.
As an advanced nurse practitioner, I think we've got a key role working with Stockport Together in enabling patients to self-manage their condition at home and live independently and autonomously for as long as possible with the support of a care coordinator like an advanced nurse practitioner, supporting them, being their advocate really to all the different organisations to allow them to keep well at home.
One of the most positive and exciting aspects of it is that we are actually going to be accommodated in the same building, so that will be all health and social care together. But obviously for our patients that's going to mean better outcomes for their treatments and also their services. We'll be able to speak to each other so we can get them the better outcome for whatever treatment they may need.
We're now meaningfully going into a period where there genuinely does feel like there's a team wrapping around an individual and their family that has a broad understanding of not just, if I'm a social worker, the social care needs, or if I'm a district nurse, not just around the health needs that are impacting on my input with that person, but genuinely a collective understanding about everything that's going on for that individual and their family.
But that can only work if people themselves also start to take much more care of themselves in terms of lifestyles, in terms of the choices they make, and in terms of how they use this new 7 days a week health and social care system that we're constructing.
For more information on Stockport Together or to view the other videos, please visit www.stockportpartnership.org.uk.